Good evening, everyone. I am Richa Sarah, Editor-in-Chief, Responsible Hospitals, and today I would like to welcome all of you on our Insta Live channel. So today's, as you all know, that our all sessions are very important and very useful to each and every one of you. So this session is again, which has come up with another topic called conception. I think this is a problem for all these days that everybody wants to expect the baby in the late 30s, but that's the problem, and that's a big challenge for a lot of females. And we will be talking about this in detail with Dr. Aakriti Gupta with us. She's from Dehradun, and as we are expanding, we are getting our doctors across India. And I think this is something which is going to be very, very important and helpful for all of you. So I'll be just adding her soon as I get my audience live. So team, can you just connect me to Dr. Aakriti, please, so that we can just start the session immediately. We will be talking about pros and cons of conception in late 30s in detail. So anybody whoever is interested to know about this subject and facing such kind of challenges which are related to this topic, and any of your friend who is actually consulting the infertility part would really be helpful and would really be great, so that we can actually help each one of us, or among every one of our friend that with a big learning or any important information passing that. So I think this is the right platform wherein we get lot of doctors and information and content for you every time, every week, which is really helpful for our audience with different subjects, with different topic. So I think this is what we want our audience to listen with the right way. So I'm just trying to add her right here. Dr. Akriti's live, I think, probably in a minute's time. Good evening, Dr. Akriti. How are you doing?
Hi. Yeah, I'm good to hear you.
Yeah. So, Dr. Akriti, first of all, I would like to welcome you on our Insta Live session on the pros and cons of conception, I think, which is the biggest challenge these days. As you all know, I mean, everybody knows about this subject that, the lifestyle has totally changed and the
Yeah.
people thought process is totally changed. And now people want to actually, they make plans to conceive and they take a lot of time. And by the time they want to do it, they're not able to do it. That's the biggest problem. So I think you are the right person to talk about it. So we'll start the session right away with this question, that what is the right age to conceive? Is it the right age when we talk about 30s or late 30s?
So you see, Richa, that the right age is actually, if you mean, is either biological age. Okay, one is when the woman is ready, physically and emotionally to bear a child. The other is the biological age, and these two can be actually different. Someone can be ready at even 20, and somebody can be even ready at 40. So there'd be a difference in that right age for the lady. Acceptance to pregnancy, but there is one called as biological age, so that is a different thing. So if you see, according to the women, for her, right age could be any time when she's actually independent, she's actually feeling comfortable to go ahead with pregnancy. Second, if you talk about the biological age, then we see it as between 20 to 30 years of age, because that is the time period where the eggs, or you can say the lady, has a good ovarian reserve. So by ovarian reserve, we mean that we have good number of eggs in the ovaries, mostly. Okay, and after 30, and actually after 35, they start to gradually decline, with age. So we consider 20 to 30 at the ideal biological age, and that's what people say, that the biological clock starts ticking after 30. So we must get married and have kids before 30. So that's one thing.
Sure. So what do you think? Do you think, since you already know, and I also know that, people are already knowing these facts and they're still planning their babies in late 30s, how does it impact their life?
I mean, the late pregnancy, that how is
Yeah.
impacting it? Yeah, yeah, definitely it will impact, because there are pros and cons of everything you choose. You might be you might be dependent, you might be independent after, I mean, at the age of 30 or beyond that. You have a secure career, you have a good job, and you have a good husband, of your choice. You have a good family to live in. So those things are there, but then it might happen that your biological clock has started ticking, and you have got a less number of eggs when you start planning. So now everything people want to plan, like they have a criteria, like, okay, in next year I'll achieve this goal. Then everything is goal oriented, so they consider pregnancy also as a goal. Like, I have to get pregnant in like 1 year. So this I'm saying for my colleagues itself and my personal friends. They come over to me from different fields. They say, okay, no, I should be having a kid by 31. So you can't do that. You can only try. There has to be some, you can't just put goals that, okay, by 31 I should be pregnant. Obviously, because everybody now is goal oriented, target oriented. So they when they are comfortable, they have a goal, like in 1 year I should be pregnant. So that again impacts on their mental health, because they start doing it and then they get frustrated in 3 or 6 months that why it is not happening. So then they come to a doctor, because they haven't tried 1 year. So they come in every 6 months. So for them, this period also decreases. They come too early to you, although they are late in planning, but they come too early in the process of trying naturally, and they start the treatments early also. So these could be the effects. Plus, then once you cross the age of 35 and 40, you have the health effects on the lady. So you are predisposed to hypertension, you are predisposed to dyslipidemias, lipid profiles, they get deranged, and diabetes, all those kind of things. And if your lifestyle is bad, you have smoking and alcohol in your lifestyle, so that adds to the problem. Your eggs start falling even, more. Besides, even for the males also, the sperm start falling even more.
Sure. And which are other health factors which really impacts the conception part?
See, basically, besides all those medical issues and the family issues in the, related to health, like hypertension or diabetes, as you say, thyroid, okay, these issues can be there in the female. Similarly, these can be the problematic issues in the male. So it has to be both the partners together. And besides that, even when what things affect the health are, like, you have smoking, alcohol, for the ladies as well as for the males, both. It affects their eggs and sperms respectively. So the quantity has to be like, there are set limits, and over the period of time, exposure to heat, what profession they are in, exposure to chemicals, toxins, and even, various kinds of stress, not just physical stress, even the mental stress, like some turmoil at the workplace or home, all those kind of situations. They also influence the health of the reproductive health, actually. They affect the reproductive health, and therefore they can have an influence on conception. They might be, these might be the reasons causing you difficulty in getting pregnant, not just your age.
Sure. Doctor, I'm already maybe in mid 30s, but still I want to know, is there anything I should be more cautious?
See, if you're planning late, like, the things you can be more cautious is that you have to be having a balanced lifestyle. You have to prevent weight gain. There should not be like you are having a sedentary lifestyle at your workplace and you have no physical activity of that sort. You are very busy in your life, so you don't give time to your health. So you have to have a physical activity routine, which is any form. You could do it in daily routine. Can be just walking, or skipping, jumping, whatever which you like, cycling for that matter, gymming. So find time for those things which you actually love, so that you can incorporate it daily in your lifestyle, not just going thrice a week to the gym, or maybe doing it for 1 month and then skipping it over. So those things should not be there. You should try and be healthy in your physical as well as mental health. So for mental health, when we talk about things like meditation and yoga exercises, stress relieving breathing exercises. Those things are very important when you are in a corporate sector, or whether you are working as a doctor or any other field for that matter, lawyer, or any other educationalist as well. So because so much is the life is so busy, and we all, those who are living in metros, half of the time is gone in traffic. So the time span for themselves actually decreases a lot. So I think they should be preferring such things of stress release, inform for improving their mental health. Plus, for physical health, they have physical activity, and also good eating habits. By good eating habits, I again want to lay stress. Try to quit smoking and alcohol and tobacco if you are chewing it. Then eat good of green leafy vegetables and water, and good antioxidants in your diet. Antioxidants could be in the form of fresh fruits, vegetables, salads and dry fruits. So those things.
Sure. And again, I've got some other questions related to the same. Is that child delivered in late 30s achieve their milestones late?
No, nothing of that sort. Nothing.
Another question is that children pregnancy late? I don't know what is this question. Probably we'll move forward. So another question which I wanted to check, is there any procedure or any steps which somebody needs to follow while going for conception?
Basically, for conception, if you are trying naturally, for that matter, if you're trying naturally for the first time and you are going to a doctor, and if you really want to know what all steps are there, they'll tell you about the fertile period. So, fertile period would mean that what time of your menstrual cycle, there are higher chances of a lady getting pregnant. Okay, so that is called as a fertile window. So, I'll give you an example. Like, for example, if you have a 28-day cycle for a lady, so 14th day is supposed to be the ovulation day or the egg release day. So somewhere between 12 to 16 falls the maximum chances of a periods, day 12 of a periods to day 16 would be the maximum chances of her getting pregnant. Okay. And the chances are more prior to egg release. And after egg release happens, they actually decrease a little. On the day of egg release also it's good, but after that it starts decreasing. So 12, 13, 14 and 15, 16, for example, would be their good fertile days. So they need to know that time period, they need to try in that time period, and then try it for every alternate month or accordingly for 6 months continuously. Then only I think they should consult a doctor and take their advice, like what all steps we need to follow now, take medicines or whatsoever. But first 6 months they need to know that they have to try naturally, and then only go ahead with their test. But still, if they want to consider them, they want to know that whether there is some problem with their eggs or not, so they can talk to the doctor, and proactively they can actually do a test called as AMH, which is a very simple test, and it can be done anytime during the period cycle. So that would actually tell the quality of the eggs, and somehow they will give you an indication about the number. And if you don't want to do AMH, you can also do a ultrasound, a basic ultrasound on your second day or a third day of periods. That would also tell you the number of eggs a lady is having. So that could be the basic things which you can do. And even for the males, you can go ahead with semen counts if they are comfortable in the first visit only, proactively for planning pregnancy. And if they're not, they can just try for 6 months and then come to the doctor. So it's two ways. Some people are actually very concerned, so they go ahead with the test first and then they go ahead with the natural trying. So you can do it. It is actually a personal opinion, but we as doctors would not recommend it, because it's still told that only once you do try for a year, and then you should come to visit a doctor if you are not able to conceive in 1 year of unprotected intercourse. And for 35 years beyond, it is 6 months.
Sure. And does the late conception affects the fetus also?
No, it actually, in a fetus, you will say that it will affect in that sense that the risk of chromosomal abnormalities or genetic, abnormalities like Down syndrome, if you've heard of it, there is a defect in the chromosome, and those kind of things would increase, because as the age advances, the defects in the mother, probably the chances are greater as compared to in their father. So it can come from either of the parent, but for the mother is obviously more predisposed. So once that age increases, that thing can, have an effect on the baby. You might have an increased incidence of Down's baby. defective chromosome formation, and that can be there. So this is how it affects the fetus. Secondly, how it affects is that ladies are more prone to develop medical disorders, as I told, after 35 and 40 years, whether it's before pregnancy or it's after pregnancy. So they are predisposed to hypertension, thyroid issues, diabetes, and all those issues, which will have its own complications in pregnancy. And that is how the baby will be affected. So that is how, again, fetus can be affected.
Sure. And my very important question to you is that how does these advanced medical treatments which are available these days can actually help the woman to, for, having the conception even a little late? What do you
See,
think
this is
about
this
that?
is
Because
the
that's the
concept
method
of
which I really
advanced.
want to give it to people.
Yeah. This here comes the role of egg freezing, which majority of women in the metros, you would have heard Ekta Kapoor done it. You've heard
Yeah.
Lisa Hayden done it. So all these people, Lara Datta, they have actually done is they have frozen their eggs in the late in maybe in around 30 years of age, knowing that they're not going to get married anytime soon in 10 years or maybe 5 years, something like that sort. So for that reason, if that time your reserve would be good, so you can freeze your eggs, you can undergo a procedure. It's medically indicated now. You can go for that procedure, which is something like where we give injections and we stimulate your ovaries and we form the eggs, and therefore we then aspirate it and then we freeze it. So it's like a bank. We keep it in a bank and we store it there, and it's accordingly maximum you can store it for 10 years. So for that, after 10 years, if you think you want to renew it, you have to renew that freeze thing. But then maximum you can do it for 10 years. So what you do is, once you think that you are okay and you're ready for getting married or you are ready for getting pregnant, so you go to a doctor, and then that those eggs are taken and the semen from your husband is taken, and it's a test tube baby is made, which is called IVF technique. And then that baby is transferred. That's your own baby. So that baby is transferred into the lady, and that's how she becomes pregnant. So that can happen even after 40. So this doesn't mean that this will decrease the risk of chromosomal defects, but the risk of hypertension and those things won't decrease, because her age would be 40 and she would be predisposed though. Only that risk of genetic disorders and those things would decrease in the baby. But the other things which are because of the environment, like hypertension or diabetes or even thyroid, all those things which come with age, those will not decrease. So
I'm sure,
that
definitely, because you are anyway conceiving little late, or you anyway have to take care of the baby. And when we say that delivering a baby is a little easier than raising a baby, so I'm sure that's going to be a difficulty later on. Yeah. So, my another question to you is that what are the options available for conception if a woman is not able to conceive naturally in
Mhm.
her late 30s?
Mhm. So even if in her late 30s, for that matter, any time after trying naturally for a year, if she's not able to conceive, we have a set protocol of investigations to be done. So that is one is for the female and one is for the male. So it's not always that we have to take care of that female is not being able to conceive. It is actually a couple is not being able to get pregnant. It's not
True.
always the female. So because it's 50% a role from both the ends, and that's where the fault lies. We keep on treating the lady and we don't pay attention to the male. That is actually not true, because male has an influence. Sometimes, many times previously, 3-4 years back, people used to just be after ladies to get themselves treated, although they would be like fine. And in the end, after like 1 year of treatment, once the husband finally agreed to get the semen analysis done, then they came to know that okay, now he is also having a problem. So all that treatment gets in vain. So whenever you try and go for the treatment, both of you should go. The couple should go together. They should get investigated together. That enhances their bonding and also gives them support to each other. Plus, it also gives confidence to the
Absolutely.
doctor that these two are together. So we have a set protocol for both of them. We have to investigate the egg number. We have to investigate the egg release. Then we have to investigate the tubes, the uterus, and step by step we proceed. Then we come on with the few tablets to form the eggs, followed by some injections. And thereafter, we have higher treatments like intrauterine insemination, and finally in vitro fertilization. So we have everything in a stepwise manner. Plus, in case if somebody has an indication for IVF directly, we go ahead with that. So it depends upon what problem, where the problem lies, whether it's what degree of problem is there in the female and what degree of problem is there in the male.
Sure. Any specific message, or I would say any tips you would want to give it to the parents or the expecting mothers who all want to conceive at that time, maybe in late 30s, as we are discussing
The
about?
first thing, the tips would be these only, that they have to stay away from smoking and alcohol. That is the biggest thing they can do. Have a healthy lifestyle. Don't gain weight. Try and, be healthy in both physical and mental sense. Have a good physical activity. Eat more of antioxidant rich diet and drink lots of water. Plus, the males should be away from heat and smoking and alcohol, because that has a negative effect, deleterious effect on the sperm quality, and they don't even realize that. Okay, not just sperm number, the shape and the DNA of the sperm starts getting damaged. So that's more for the males to stay away from smoking and alcohol. And as a couple, whenever you go to a doctor, try and investigate yourself together, so that you have confidence that both of you are getting treated and you are going to have a baby. And definitely try naturally first. Don't panic, don't Google too much. Just know what your basics are, just know your basic anatomy and physiology about your body. That's it. But always trust the doctor, talk to the doctor, and follow the instructions. Just don't Google up.
Yeah. So my last question to you is that since you know that a lot of people don't, you clearly said that they don't have the patience to wait too much.
Yeah.
Once they start trying, they keep on checking every month. Oh, it's not happening. It's not happening. They get panicked. They get nervous, and that's also giving them, hypertension or such kind of things. What do you think? Till what time frame they should wait, and they should go and see the doctor later on? That it's not working
Yeah.
out, and we should just go and see the doctor now.
Yeah, that is also very important for them to know. That I told initially also, that what exactly labels a couple an infertile couple is when the couple has tried naturally, for 1 year at least, and that too
Okay.
unprotected intercourse. So
Okay.
that, why is this period 1 year? Because it is seen that in 80% couples, they conceive in 1 year if they try naturally and unprotected intercourse is there. And almost 90% of such couples, they conceive in 2 years. So, the infertility problem is just 10 to 15%. Only that we are now more aware and we have less of patience, that, more people are coming out and talking about infertility. So, second thing, if the age of the mother is beyond 35, then that time frame decreases to 6 months. So she has to try 6 months naturally and unprotected intercourse. And if in 6 months she's not getting pregnant, then she should consult a doctor. So the time frames are different as per the age of the lady, because age of the lady matters more than the age of the male.
Sure, sure. Even if the age gap is quite high in between both of them.
So
I
age
said
gap.
in case the person, if the man is 40s and the girl is, let's say,
Yeah, because
35.
the sperms usually, the sperms, they keep on producing. Every 3 months they have they have a production of sperms. But what happens is, in females, the production of eggs only happens during, in utero, when the baby is inside the womb. That's the only time when the eggs are formed. After that whole life, the eggs are getting decreased. They are getting used up. So they actually fall out. For the lady, there's no new regeneration of eggs. It's one constant number which is there in utero once she's inside the mother's womb. And once she's born, after that it keeps on falling. So that is one thing. And for the males, it's not like that. So every 3 months they have production. So that's the difference. So that's why the age limit for males, we don't consider that much. Even a male of 40 and 50 might have a very good count and fertility, rather than that same age lady would be having like so many menopausal or perimenopausal symptoms at that time. So that's the
Yeah.
reason.
Sure. Thank you so much, Dr. Akriti. It was really informative session, I would say, and I'm sure this message and this kind of information will really help a lot of our audience. So thanks so much for being with us.
Thank you, Richa.
Thanks. Bye bye.
Okay. Bye.